I'm going to be running through some of the core functions of what Healthwatch is about and how Healthwatch moving forward is prioritising some of the large remit of Healthwatch. With the statutory network across England, we're part of a statutory network across England. As Vanessa was saying, we're the official patient voice. We're embedded in the Health and Social Care Act of 2012. So rather a lot of responsibility for a small organisation to deliver patient voice. What Healthwatch means for Croydon, we work to help Croydon residents get the best out of health and social care, and we ensure the overall views and experiences of Croydon residents are used and supporting the improvement of quality in health and social care services. So working in partnership with the council and the many NHS organisations. We try and make sure that your voice is heard and taken seriously at both a local and a national level. I attend meetings at NHS England every month. I liaise with Healthwatch England, which is the peer support for all the health watchers in the borough, who then liaise with the Department of Health directly on behalf of all the health watchers. So pretty powerful tool. Just to go over the six core functions that are laid out in the Health and Social Care Act of 2012 is gathering the views and experiences of Croydon patients and service users, as mentioned. Also, you may be familiar with the Enter and View programme. We're hoping to deliver 2 Enter and View visits a month. As you may or may not be aware, 50% of the care and nursing homes in the borough of London, 50% of London care and nursing homes are actually based in Croydon. So it's quite an effective tool to go in and be a citizen's eye and make observations about those homes and feed back to that provider to drive up quality. Third function is we promote and support the involvement of public participation. Many of you here today do some of that on behalf of Healthwatch. So the patient voice at strategic and decision-making meetings. Thank you to those who do that for us. So under that Health and Social Care Act of 2012, we can actually make recommendations for the CQC to go in and visit. I haven't had to do that here just yet, but we work closely with the safeguarding team and the contract monitoring team in the borough, based at the council and at the CCG. Fifth function is information and signposting. So I'm sure you're aware many of the third sector organisations in the borough already deliver that service, but we work in partnership with them, gathering up existing patient experience, their information, and also signposting members of the public to support them in navigating the quite complicated NHS and social care system. And as I was saying, we make sure that those views and those experiences that we gather through our outreach, and we make them known at the CCG, the Health and Wellbeing Board, and NHS England, amongst others. So going forward for 2015-2016, to flesh out some of the large remit that Healthwatch has as we cover the breadth of health and social care and dentists and opticians. We want to continue to develop our engagement with community groups and develop gathering feedback with Croydon residents. And the photo there is of Yinka and Anamika, 2 of the staff who are at Croydon Hospital asking for feedback. So it's that independent voice that we can gather. Working with Age UK, we're funding an Age UK project to gather patient experience of being discharged from hospital. We're at interim stage now, and that should be ready towards the end of the year. And that's to support the hospital and the CCG and Croydon residents in that experience of hospital discharge and drive up some of the quality. And it's actually a national priority to review and research some of the experiences of patients in being released from hospital to see what their needs and concerns are to make improvements. Again, this has already been published, but the patient experience of being admitted into a mental health hospital in Croydon, that's now available. The report has been press released. It's available on our website. As I was saying earlier, continue to develop the Enter and View programme, and we're recruiting potential entry and view volunteers today, if you'd like to be involved in that. We want to support the public and our partners, the hospital and the CCG, in the transformation of integrated care. That's joining up the NHS and the social care services. It's the writing on the wall, it's transformation, and we want to be making sure that we have people's experiences ahead of some of the redesign of services. And continue to ensure that the work of Healthwatch is engaging the breadth of all the characteristics in the population. And also meeting and running workshops with children and young people, so engaging with some of the third sector organisations that are already regularly in touch with children and young people, whose remit may be, for example, supporting children with learning disabilities. But that's their day job, to support the person with learning disabilities, but the opportunity to Healthwatch is engaging with that expertise of that third sector organisation, but actually asking and supporting them in gathering the views and experiences of the health and social care system while having that disability. Something that's changing nationally is the commissioning of primary care, and it's important for, I feel, Healthwatch to be in touch with that, in touch with the GPs and the commissioning groups and NHS England, and seeing how they are unfolding that commissioning of GP services. And I want to be there with the other Healthwatchers in the country, providing patient experience of the GP and providing those patient experience reports in the changes of commissioning of primary care. So, and again, supporting the improvements of the CQC, some of the issues that the CQC report has uncovered, because it's recently been in some primary care venues, the GPs, it's been at the hospital, the report was out yesterday, that's in the press, and it's also been in South London and Maudsley venues. So it's working with those providers and ensuring that they're aware of the patient voice, and working with those providers to make a response in the improvements that the CQC reports have flagged up. Continue our activities and gathering experiences at stalls, the hospital, community events, and doing outreach at GP surgeries. I met the LMC the other day and actually engaging with GPs to support us in gathering that independent patient voice. We're going to continue to respond to health and social care providers' consultations. So when they're redesigning a service, quite often there's a draft of it, and that hopefully, over time we'll continue to get sight of those consultations and involved through our advisory forum, through our website, through workshops, and gather that patient experience to feed into those consultations before the redesign takes place. And as I'm sure you're aware, that Healthwatch has a statutory seat on the Health and Wellbeing Board to support them improve some of the health inequalities in the borough. And we're already providing patient experience there, for example, in October in people's experiences of patient transport. Ways of supporting Healthwatch Croydon is it's a place to volunteer. So if you've got members of the family who want to improve their CV, or they really they have the time to give back to a charity organisation, for example, or they really feel passionately about their the NHS, but rather than perhaps volunteering at the hospital, they want to volunteer for Healthwatch Croydon. There's an opportunity to join our advisory forum with your expertise in health and social care. You can do this via email, so we can email out the consultation to you, or put it in the post if you're not on the net, and attend our quarterly meetings. We have an advisory forum coming up in November, and that we hope to have speakers from some of the providers and do workshops with the advisors there. Do invite us to any third sector support groups or coffee mornings, and in actual fact the NHS coffee mornings and council coffee mornings too, but really we want to get engaged more with community groups. You may be familiar from advertising with our patient experience panel. Most Fridays my colleague Darren runs a patient experience panel where he clinically codes with volunteers some of the comments that we collect through PALS, NHS Choices, Care Opinion, and through our outreach. and goes over, it's quite interesting, you go over comments and code them, and that's then, we can pick out themes and trends on some of the services in the borough, and those reports then go, hopefully, to the CCG or back to the provider to give that patient voice at a high level and make a difference. And we would like to continue to signpost people around the NHS and social care system.